Here on The Colour of Country Life, great to be speaking with Senator Anne Ruston, Minister for Families and Social Services, I believe, but also the anointee if the government wins the election as the Health Minister to take over from Greg Hunt. Have I got it all correct there, Anne?
You certainly do, Ricky.
And you're also based in the Riverland of South Australia as well, which I'd like to talk to you about the river a bit later on. But first of all, the ANU's got a poll out this morning indicating that there's a lot of women, more than men, that are still undecided about who to vote for this federal election. Why should women vote for the coalition?
Well, I think the coalition's got a very strong record of putting things in place to support all Australians, but particularly issues that are important to women, whether it's been the significant changes that we made to childcare, which now sees 250,000 families with one or more children in childcare being able to receive up to a 95% rebate on their childcare fees, which is such an important change because we were hearing that a lot of people with more than one child were finding it prohibitive in going back to work. In my own portfolio area of women's safety, largest ever commitment by a very, very long way, $2.5 billion towards women's safety in addressing the scourge that is family and domestic violence in this country. So I think this government has a very strong track record, and particularly in health. I've been really, really pleased over the last few weeks to have been able to stand with the Prime Minister and Greg Hunt and make announcements around things like the investment into endometriosis. 800,000 Australian women live with this really debilitating condition, and now we've made some significant investments not only in the treatment but early diagnosis and response to it. And big shout out to our local here in South Australia, Nicole Flint, who has championed that. Just a couple of weeks ago, some great news for people who are struggling to fall pregnant, particularly those people who are having to undergo cancer treatment or may be at significant risk of genetic conditions that would have serious impacts on their pregnancies, additional funding to be able to support them. So I think there are a lot of reasons why Australian women should be absolutely confident and comfortable that the coalition government really understands the issues that are important to them and is doing something about it.
Now, I want to talk a bit more about health in a moment, but you've been anointed as the Health Minister if the coalition wins the election. That would place you as one of the most senior women probably in the coalition government alongside Susan Lee, the Environment Minister, I gather.
Well, we've got a great team of women that are currently in the Cabinet, the largest ever number of women to sit in a federal Cabinet. There's 8 of us that sit around the table. And some really big names heading that up. Maurice Payne as the Foreign Minister, Michaelia Cash as the Attorney General. We've got Linda Reynolds, who looks after one of the most important social policy areas with the NDIS. Of course, Susan Lee as the Environment Minister. Melissa Price, who works in Defence. Karen Andrews is the Home Affairs Minister, who has absolute responsibility for the security of Australians at home. And, of course, Bridget McKenzie, who is probably very well known to anybody who lives in rural and regional Australia as a National Party minister who champions just about everything rural and regional, including things like rural and regional communications, rural and regional education and development. So we've got a great team of women that sit around our Cabinet table.
Well, Anne, when we're talking about health, one of your Liberal Party colleagues in South Australia, Rowan Ramsey, has been kicking around this idea of tying a Medicare funding number to a postcode to sort of compel graduates and other doctors to work in regional areas. Tony Passon, his neighbour, who's your local member, has said he thinks it's the nuclear option, but he says it's under serious consideration to address the shortage of doctors in regional areas. Is it something you'll consider as the Health Minister if you appointed that in the next government?
Well, I think to the point that's being raised by both Rowan and Tony about the need for us to put incentives in place so that we can encourage more health professionals, particularly rural specialist GPs, is something that we really do need to be looking at every option that we can, because we understand, and I mean, you and I both know, living in rural and regional Australia for most of our lives, the huge challenge it is to get health professionals to agree to move to country areas. Because, as you know, a doctor in a rural and regional area doesn't get to knock off. They might go down to the pub for a beer, but somebody's still asking them a question. The nurse may go shopping and somebody will stop and ask them something in the shopping centre. So it is a very unique place in the health system. But I think, we put some things in place in this budget around the new training places. We've got 80 new Commonwealth-funded training places for doctors that are specifically required to be taken in rural and regional areas, because one of the things that we do find is that if doctors train in rural and regional areas, they're more likely to stay there. The challenge we have is when the young country kids who want to be doctors go to the city to train, and they develop a network of friends in the city. They may fall in love or find other things they want to do in the city, and they don't return to the country. So I think there are things that we are doing, but I think there's certainly things that we need to continue to look at, because we do know there is a huge challenge with regional and rural health workforce, and we should be looking at all options.
Anne, I know you are passionate about this one. It's a former portfolio you held, the River Murray, the 450 gigalitres that's meant to be delivered under the Basin Plan across the border in the seat of Mallee. Both the independent candidate and Anne Webster, the Nationals candidate, said either it can't be delivered physically through the river channel without doing more environmental damage, or in Anne Webster's case, she said it just can't be delivered because it won't tick that triple bottom line of social, economic and environmental positives. But that's something that's Tony Passon said it has to be delivered under the Basin Plan. It would be a breach of that plan if it isn't delivered. Where does the coalition as a whole stand on this 450 gigalitres?
We still remain absolutely committed to the delivery of the Murray-Darling Basin Plan in full. But as is rightly said by everybody, and it's enshrined in the legislation, that we must deliver the plan in a way that doesn't destroy our river communities. And obviously, my community of the Riverland in South Australia, we have done a lot of heavy lifting when it comes to the return of the water for the basin. But, we believe as a coalition that the best way to return water to the environment is actually doing it through clever, innovative ways using technology and infrastructure, not just by ripping water out of communities. We will stand and remain steadfast in our position that there will be no more water buybacks. We put a cap in place at 1,500 gigalitres and said that there will be no more water brought back from our communities, and that 1,500 cap will remain in place. And that is the significant difference between what we're saying as a coalition and the other side are saying. They will just immediately, I'm sure, go straight back to water buybacks, and we saw the decimation in our communities for that. So we are committed to making sure we deliver this plan in full, but we'll use things like off-farm efficiency measures. We will do things like making sure that the cities also play their role through urban and infrastructure projects, because we believe urban and industrial water can play a role in delivering some of these targets. So we're absolutely committed to the delivery of the plan, but we'll do it in such a way as we don't just rip water out of our communities and decimate them.
A couple final points on that. You've used the language delivering the plan in full. Maybe it's Labor who always say in full and on time. What happens at the 2024 deadline under the Basin Plan? Do we have no choice but to go to buybacks?
Well, we would say as a coalition government that we won't go to buybacks because of the detrimental impact that would have on our river communities. And I think one of the messages that we need to get to the city, who are saying around the country that are saying that it doesn't matter how we get to the targets, and if that means buybacks, so be it, is this is where their food comes from. So they sit down to dinner tonight, and they've got beautiful fruit and vegetables in their meal. That comes from the Murray-Darling Basin in large in Australia. And so we need people to understand that this is a balance between making sure we've got to continue to have a really healthy and productive economy in the rural and regional areas in the Murray-Darling Basin, but at the same time, farmers are the ones who want a sustainable river system. They're the ones that stand to gain the most from a sustainable river system. So this idea that farmers don't want a long-term sustainable Murray-Darling Basin is just the silliest thing I've ever heard. They do, but they want to do it in a way that doesn't destroy their communities and doesn't destroy the economic fabric of so many areas in rural and regional Australia. So I think the answer is we can do this. We shouldn't give up. We shouldn't take the easy way out. We should focus on delivering our targets in a way that we can, using infrastructure, technology and innovative ways, instead of just taking the easy option, and that's ripping water out of our community.
Well, lastly, one piece of infrastructure that was installed was the desalination plant in Adelaide, which was said to reduce reliance on the Murray River. Does it fall incumbent on the next federal government to work with the state Labor government to either fund or ensure that desal plant is run more often to reduce reliance on the river?
Well, the desal plant was a very, very expensive piece of infrastructure to support Adelaide in times of low water availability. And so the economics of starting up the desal plant are obviously something that's a matter for the South Australian government. But, we would be saying that we should never go to buybacks out of river communities, and all other options should be exhausted before anybody considers taking another drop of water away from an irrigator in this country.
Now, you're not up for re-election yourself. I've got that right, haven't I, at this coming federal election on the 21st?
No, I have the luxury of not being up for re-election, but I certainly am working very, very hard to make sure that all my colleagues get re-elected, because a coalition government is so important for this country to maintain the stability that we've seen through some pretty uncertain times, and the uncertain times remain. So I'm very keen to work every single day between now and 6 o'clock on Saturday to make sure that Australians understand that the really important choice they've got, choice between a strong government with a strong economy for a strong future and the alternative.
Thanks, Anne Ruston, very much for your time, very generous, and all the best on the 21st.
Thanks, Ricky. Take care.